Sideways.
Sideways.
It looks like you're in a gravity eliminated position.
Oh man, we're really getting into the pelvic floor stuff.
Yeah.
All right, give me one.
Why was that the first thing that I thought of when I saw that position?
Probably because you're a really good pelvic floor physical therapist.
Oh, it's so nice that you were able to join Dr. Nick. I'd like to share with you guys just a little bit about my connection with Dr. Nick. We were at a class, a pelvic floor level 3 class in Ohio this last fall.
Mm-hmm.
And there is Dr. Nick, and I'm so impressed. He was the only male, and he's actually been the only male that I've been in a pelvic floor class with. So I love that you're a PT that is going into this field. So very important, and I'm so happy to connect with you.
Yeah, I was really happy to connect with you, especially someone who's done such, a justice to the pelvic floor conservative management physical therapy community through your My Pelvic Floor Muscles, Instagram and website and all that.
Thank you. It's a pleasure. It's a pleasure. I love every minute of it. So it's hard to go to sleep at night. I'm like, oh, what do I want to do? How can I portray this? Really trying to figure out a way to connect people with their pelvic floor, because it's not something most people have heard of, but awareness is increasing. So that's great.
Yeah, no, you've done a great job of that. And to the point of you're never sleeping, I mean, I know there are a million different little snippets on your page, so it's great. You really don't sleep.
I know. Oh. Well, okay, so tell me let's share with the audience here a little bit about yourself and your background, please.
Oh, yeah, sure. So, grew up in New York, and that's where I went to school. I got my bachelor's in kinesiology, exercise science. It's the State University of New York at Cortland. Uh-oh, did one of the plants fall? Better the plant than
I'm going to set it on the side. Woo! Okay, good.
Well set?
We're good.
Yeah, so that's where I started. And then, I knew early on I wanted to do physical therapy. So I went to get my doctorate at Stony Brook State University at New York at Stony Brook. Out on Long Island, and I knew during that time, my first semester, I wanted to go into pelvic floor physical therapy. So
really?
I took my first pelvic floor course in Arkansas during I think it was the second year was the first that you were allowed to take it. So yeah, I continued on from there. Went on to Connecticut, where I worked under someone who specialized in pelvic floor physical therapy, who is also happens to be a male. So it was nice of him to take me on, because I did have a little bit of trouble finding someone who would, and mainly because they didn't want, a male working with them. But that's okay. And he took me on, worked under him for about 2 years, and then took some more courses, moved down to Georgia, took some more courses, and here I am.
That's excellent. Excellent. So speaking to your point a little bit about finding a rotation or finding someone that would take a male pelvic health student.
Yeah.
We have some clinics in Central Texas, and we've taken at least one. I think we may have had 2 males, and they said, so many clinics turn them down. And I find that really frustrating. Think about how many OBGYNs are males, I'm glad that you're kind of a trailblazer here, and I support you wholeheartedly. So.
Oh, thank you. It's, you try not to, you can't really take it personally. I mean,
no.
Yeah, I get it to an extent, for the patient, who's used to being with a female only in the room, now you're bringing someone who's not only, another gender, but also completely inexperienced. And it could be a religious thing, or, just a spousal thing where the partner's not comfortable with it. And, like I said, I get it. So it was frustrating, yes, but at the same time, so grateful that, someone was able to take me on.
Good. And then, I think you have a unique opportunity as well to connect with males that have pelvic floor dysfunction, right? And think about how many people out there, how many males. So anyways.
And it's becoming more prevalent too. It's great. I definitely see a huge increase in the amount of male patients that I'm getting.
Good. Thank you all for joining us. We really appreciate you being here. And one of my good friends, Med School Life, from the very beginning on Instagram, he's been just a huge support. So I'm honored that you guys are here joining us. All right, so let's jump into talking about erectile dysfunction. Go ahead, and can you just briefly go over the anatomy of an erection? How does it happen, and what is the role of the pelvic floor muscles?
So, an erection is, there are three different types of erections, first of all. Those that happen in your sleep, those that happen from direct genital stimulation, and those that happen from any of the other four senses or like mental imagery. But pretty much when the erection process starts, hormones are circulating around the penis, and arteries begin to relax, and smooth muscle begins to relax to allow passage of blood flow into the penis. And if you think of it kind of like from a cartoon standpoint almost, the veins begin to contract on the other end of those arteries. It's a closed system, so blood goes in, and then it has to come back out of the penis, but the veins close to try to hold it there. And if you, like I said, I was trying to go on the cartoon route, but you hold one end of the hose, and then the back end starts filling up really big. So that's kind of like the blood getting into the penis. And so the pelvic floor muscles, so there's two for erectile function, ischiocavernosus, bulbospongiosus, and one contracts to engorge the penis, to help with engorgement, and then the other one contracts to hold it there, and it helps with hardness and rigidity.
Good.
So.
I have a couple little just models here that I'm going to show because I'm a very visual person. So this is a dilator that we use in the clinic, but I've turned it into a penis. Okay.
Okay.
This is a very, very crude representation, but the pelvic floor muscles are basically wrapping around the base of that penis, right? To keep the blood flow where it needs to be.
Yeah, exactly. Mm-hmm. And it helps get some of it to it. I mean, I don't know how many men are on here or females who have, a male partner who like to participate in male exercises. But yeah, when you contract those muscles voluntarily, typically you'll notice not only that the shaft changes its angle, but you also notice maybe like the head gets a little bit bigger, a little more engorgement. So it does help pump some of the blood to the penis.
Good. Now, I want to try something new if you're willing. I hope that I don't disconnect anything, but I'm able to press an image here, and I wanted to show, because we actually have a contraction. It worked.
Oh, man, I love visuals too, by the way. All of you, that's like the best part of it.
But I mean, a picture is worth 1,000 words. So you can see, and my head is in the way of part of it, but you can see the penis.
The important part right now, right?
Yep. And, you can see a little bit of the gas. So basically when the muscles relax, right, urine comes out, and then when they contract, it should lift up. So that's a fun little visual there. Now I'm going to try to bring me back. Okay. Hey, that was beautiful.
Worked out really well.
It did work out well. Okay, so then tell me some of the risk factors and some of the problems that can occur with erections.
So I think and I hope I'm going down the right route of answering this, but erectile dysfunction is a symptom. It's not a disease. So when we look at erectile dysfunction, we like to think, okay, have other things been ruled out? And actually, one of the questions you sent me was spot on. They asked, is it a sign or a symptom of heart disease? And not to say that it always is, but it can be. So, you really want to make sure as, someone who may be experiencing erectile dysfunction, there's so many things to consider as to why it might be happening, that you really need to make sure that you get out to the right professional. And even going to a pelvic floor physical therapist initially can be the right place to start, because they can always refer you out to the correct person if appropriate.
Mm-hmm. Good. Okay. Yeah. That's
so what was the question again?
No, and then that was a very, very good answer. So then risk factors, just kind of adding on to that, I've, a lot of times the erectile dysfunction can be one of the early warning signs of heart disease, right? So,
yeah.
So it's important to not just brush it off, get it checked out. And, there's multiple causes. So then what are some of the risk factors for ED?
The risk factors would be things like, smoking, lack of exercise, things like that. A lot of things that you would just see for heart disease, coronary artery disease. It's really a lot of the same things that you would see for that would be the risk factor. The risk factors, plural. So you can think to those things, like I said, the smoking, lack of exercise, poor diet, and all of that.
Prostate surgery too. So
the biggest risk factor though, so prostate surgery, sorry, and I just
No, you're good. We're a team here. We're working together to get this. I have notes.
You have notes. Oh, that's good. I'm going from the bottom of my heart.
Yes. I know you're busy and you're in clinic, and I thank you for working us in. So no, you're good.
Age though, that was it. So age, over the age of 40 is when you start to see that sharp increase. But there's not really much we can do to battle father time. So we work on all of those other things.
Yeah. That you can't.
We all try to, right? Like that father time. I'm starting to take some wrinkle cream, I know, but we don't get into that.
That's good. Okay, so what does therapy involve then? So what is the role of physical therapy here? How would you treat someone with ED? How would you evaluate them and treat them?
So, initially we go, it's like the same as a lot of other types of physical therapy. You go through your histories and you see kind of what is the cause of this. A lot of times it's really rare that I would jump straight to the pelvic floor because there's so many other things that could be causing it. So we'll go over, lifestyle habits, exercise habits, relationship habits. A lot of it sometimes has to do with communication, especially in the under 40-year-olds population. But really in the beginning, more so than that physical aspect, and we will take a look at that stuff, the pelvic floor musculature, but it's really just kind of getting to know the person and how they're living. When you take into consideration the studies that show, cyclers who cycle over, I think it's 3 hours a week, which isn't even that much in a cycler's mind.
Right.
To me, that's like a marathon every week. but they're at higher risk of erectile dysfunction because they're occluding. So we'll get into things like seating and cushioning, pads that they can wear and stuff like that, and what's the best pressure mapping studies that are out there right now for that. So it's a lot of stuff, communication with their partner, making sure they're not in a high stress situation all the time, and talking about trying to activate that more rest and relax nervous system versus the uptight one, because we know, or you and I know, and other medical professions on here know, we need that parasympathetic rest and relax response in order to allow engorgement of the penis.
Yeah, we need both. We need both.
Which is, sometimes a lot of people probably don't think that because, exactly. It's something that's really rigid and hard, and it's a lot of, sometimes it's very relaxing, and sometimes people are a little more rigorous in their sexual encounters. So it's a little battle. But anyway, the point was that, we need to make sure that they're not in a high stress environment all the time outside of the home too. So that's a lot of, it's education. It's huge.
I'm going to put another image up here. Because I think it's really important what you were talking about with the bicycle seat for people to see the anatomy. So here, I wish you could see me pointing, but you can see the penis, and then you go to the base of the penis, and those are pelvic floor muscles. And so think about, we're looking at the pelvic floor from below. And think about if you're sitting on a bicycle seat, all that compression that can happen there. So that's why cyclists have a higher risk. Do you happen to know the any stats or percentages there with cyclists and ED?
Ooh,
I don't.
I was going to say, you know what? I don't know, other than what I mentioned about the clinical significance of 3 hours or more. Yeah. But
I have a few general statistics from this is a research article by Cohen in 2016. So basically estimates range from 9% to 40% of men by age 40 and generally increase by 10% in each decade of life thereafter. So it's not just one little percent or 0.5%. That's a huge, huge number of people. And those are the people that are talking about it too.
Yeah, exactly.
So, all right. This kind of goes along with that. What percentage of men will have issues after prostate removal? So I don't have that specific stat, but it varies, I think, based on the study too. I've seen a lot of different statistics.
Yeah, definitely. I mean, it's anywhere. So before I say the scary number, I'll say there's really good recovery. But immediately following, it's somewhere between 80 and 90% in most of these studies. So it is big and scary, and some people don't get the education or know that might happen even with the nerve-sparing prostatectomies. So there are types of prostate removal surgeries where they try to protect that for them. But even with that, initially, there's still that 80 to 90% that wind up losing that erectile function, which is, like I said, it's scary, but there are methods to help it come back. I've read some really good research about pre-rehabilitation going into prostatectomy surgery. So a lot of people wind up doing a lot better on the other end and recover much faster than those with physical therapy than those who didn't have it beforehand. So.
Excellent. Okay. What do you think about the Get Roman program? So that is pretty much out there, and I love that they're advocating, for and talking about it. Do you have any thoughts on that?
So I actually didn't know what that was. I had to look it up. Am I correct? Is that the thing where they were saying you can get erectile dysfunction medication like sildenafil, and not have to be evaluated by a doctor?
I think they can do it all via either. I think it's a phone call or an online consult, and they can do everything and get the medications delivered to their door.
Okay, I'll just say I don't know because I'm not that familiar with it, but I would say, considering the fact that erectile dysfunction is a symptom rather than a disease, and we may want to rule some other things out first. I don't know how in depth they can do the evaluation on there.
Right.
But be thorough. It's your health.
Yeah, be concerned. It's a symptom, and it's one of the early symptoms of heart disease. So. Don't just brush it off. And taking medication may help the ED, but it may not actually do anything positive for your heart disease. And then 10 years down the road, you have MI. So we're not saying don't do it, but you want to look at the whole picture and make sure that your systems are functioning as they should before you start on a path.
Exactly. So to answer that question, I can't really say because I don't know how thorough the evaluation is, how they do it, or anything like that. But when it's your health, so maybe get into a professional first. And I'm sure you could well, I'm not sure, but maybe you could still use that referral to use to get your prescription and use that for a cheaper alternative. Because I know there's really good research out there showing that doctors who are prescribing sildenafil of some sort, which is the generic of Viagra, and they're taking it regularly, wind up having faster and better outcomes for erectile function following prostate removal.
Oh, that's good.
Yeah, so and I'll
very
see
promising.
more and more patients coming out now who are prescribed sildenafil right away, which is awesome. I mean, it's a big part of the pelvic floor physical therapy too, because we were talking about blood flow to the area, and you're mentioning the cyclists and how it kind of, they're sitting on it the whole time, the blood can't really get to the area. So if you're not getting erections, and that's a big reason why high schoolers get erections that are unaccounted for, and why men get erections in their sleep, is to nourish that area. So
we want to give it blood flow.
Right, we want blood flow. So, I mean, just a little treatment thing. I'll encourage people to masturbate.
Yeah.
That's their homework for me a lot of times. Like right off that, go home and get your favorite magazine or whatever you're into, and you know, you gotta get some blood to it. Yeah.
That's good. That's good homework. And then they're becoming more aware of their own anatomy. Not that maybe they were, maybe they weren't, but you know, I think it's important to understand how your body works and be familiar and comfortable with your body. So,
yeah.
Good. Well, we talked a little bit about what does therapy involve for this. I'm not sure. Do you have anything else that you want to share?
About the therapy, or just like prostate?
Well, let's just walk through a little bit. So if someone came into your clinic and they had ED and they'd been evaluated by a cardiologist, their heart was fine, a urologist thinks it's their pelvic floor. So they're going to come into the clinic. What does that first session look like? And then what additional homework or things might you do for them?
So we'll look at nerve function, you know, things such as just sensation around the perineal area.
So we'll get this back up because. So go ahead. So now we have the floor up here, so you can walk through it a little bit.
We'll talk about you know, the anatomy and kind of what to expect going forward and what the surgery entails, because a lot of times they still don't know that. But biofeedback is really important too in this population, because males tend to rely not so much on their volitional pelvic floor to maintain continence. So a lot of times those muscles of erectile function, which also have some function of continence,
which is not leaking, just for anybody that might be not familiar with the word. So continence means that you're not leaking urine or
yes. I apologize. Yeah.
No, you're good.
So people who aren't leaking urine, you know, those muscles, you know, have dual function. I mean, they're mostly erectile, but they're not as in tune with it voluntarily. And we'll talk about how to make it. And, you know, I try to be as conservative as possible in using visualizations for them and not having to place my hands in those private areas as much in the beginning. But, you know, external palpation of the levator ani, so that's that sling-like muscle going underneath the anus down there. I can't see if it's labeled. I think it is. Yeah.
It's labeled kind of generically. It says pelvic floor muscle, so it's not specifically labeled.
So one of the bottom muscles there, which we tend to think is the Kegel, but a lot of times I'll give them a cue more to think about making the penis jump, quote unquote. A lot of men seem to get that one. Have you used that before? Maybe
I haven't used that one. I haven't. Yeah. Somebody gave me a new cue, which was pretend like you're an elephant, so you're trying to raise the trunk. I kind of like
that's that. Good. So that's another girl. I might have to steal that one from you too. But that was actually a patient who came into me like early on in my pelvic floor rehabilitation career. Probably one of my first prostate removal patients. And I was trying to explain it to him, and he said, he's like, you know, like I'm trying to make my penis jump. I was like, oh.
I love it.
I had to think and like kind of like discreetly like do it myself while I was there, and just be like, oh yeah, exactly. That's exactly it.
Right. Yeah. How many times do therapists? Well, I might be opening a door, but when you're teaching people pelvic floor and they're doing biofeedback, how many times are we actually activating our pelvic floor too?
Oh my gosh. Yeah. That's the whole can of worms.
Exactly. It really is. So, okay, that was a great description there. So basically all of these muscles that are labeled there are different pelvic floor muscles that have different functions. And some of them work more with erection. Some of them work more with keeping urine in and bowel in and supporting the organs and so forth. And they're designed to work automatically. So that's why people really aren't that connected with their pelvic floor, because they've been usually working as they're supposed to. And then they have these symptoms or problems, and the pelvic floor, for whatever reason, isn't doing what it should. So helping to connect people and really understanding how everything works, I think, is huge. So, okay. I'm going to read this one little statement here. This is from Grace Dory. So she's a pelvic therapist, I think, in the UK, and she has really been, I think, a pioneer, especially in the field of men's pelvic health. And so in her article here, she says, I'm going to quote her, pelvic floor muscle training should be considered as a first-line approach for men seeking long-term resolution of erectile dysfunction. So I want to encourage all of you, whether you have penises or whether you love someone that has a penis or know someone that has a penis or treat someone that has a penis, think about how the pelvic floor can affect sexual function in males too. It's not just females.
Oh yeah, absolutely. That was very well said.
Thank you. Well, Dr. Nick, thank you so much for your time today. I look forward to continuing to work with you. And I love what you're doing, and I love that you're in pelvic health. So keep it up.
Thank you. And it was a pleasure and an honor to have been on, the My Pelvic Floor Muscle Instagram podcast video. I don't know. I'm so bad with Instagram. I'm like, people make fun of me. I'm like the old man of my. I just got a smartphone for the first time this year.
Oh my goodness. Well, I think there's some pros and cons to that. So, but welcome to the Instagram world. We are going to screen record this, and I'll have it up on our YouTube channel for sure. And maybe if we can work out the logistics, get it on IGTV. But IGTV is a little more finicky than YouTube. So for sure, this will be on YouTube within a week or two.
Awesome. I sure hope we can get the picture of this penis here on IGTV.
We'll see.
All right. Thank you so much.
Thanks. Have a great day. Thank you, everybody, for joining us, and take care.